Hi, I'm Dave Fielding, and I'm a patient advocate. And I'm here today to walk through the Medicare website for evaluating different care providers. So the first thing we're going to do is we're going to go to Medicare.gov, and we're going to type in the search Medicare or CMS and compare. And that will bring you to this page on the Medicare.gov website. And this is a find and compare providers near you. If you just follow the pointer, there's an introduction and a welcome to explain what this program is. And then you can compare doctors, hospitals, nursing homes, including rehab services, home health care programs, hospice care programs, inpatient rehab facilities, long-term care hospitals, and dialysis facilities. So I'm just going to walk you through an example for a hospital. So when you click on the type of provider, the first thing that you'll see is tell us a location or the name of a facility. So I'm just going to type in my zip code, and we'll do a quick search. And within that search, you'll see that there are a number of facilities listed on the left-hand side. So Mercy Medical Center, if we click on that, one of the things you'll see right away is that the page is broken down into a general overview of the types of clients that they serve, and including specialty areas. And then you'll also see under the quality, it will show you the types of clinical findings and data that's available. That includes information on complications, the results of care, effective care. You can read through the categories, but all of this tells you the performance. These are performance indicators for the facility. So under complications, for example, it'll tell you that the percentage of patients with pressure ulcers or injuries that are new or worsened was less than 1%. And the national average is 1.2%. So that tells you that this hospital is above average in preventing pressure ulcers. And there's a brief explanation that you can drop down menu that will provide additional information about that metric. The second metric is percentage of IRF patients who experience one or more falls, and this facility has a 0.2% average, and the national average is 0.1. So this facility has twice as many falls as the national average, patients that fall as inpatients. Under results of care, they look at change in patients' ability to care for themselves versus a change in patients' ability to move around. Under infections, we look at catheter-associated. These are hospital-acquired infections. So we'll look at nursing homes, including rehab services. So let's pick a nursing home in Nassau County, Oceanside, New York. So we're going to look for the facilities. And the first thing that'll happen is we put in a name of a town, and two things come up. You'll have individual boxes on the left that correspond to the individual facilities, and you click into those for additional information. And on the right, what you have is a map of the location. This happens to be of Nassau County. And you see each one of these is a different facility, and it corresponds to the list on the left. So you can see the actual location, or you can check by a location, all of the facilities in a given area. And so if we go to the first one, Oceanside, it's right here. It's the pin right here on the map. And if we clicked on that, that would pop open, or we can just go to the name and click on it. And that will open up all the information about Oceanside Care Center. This is the 5-star rating system. This is a 2-star rated facility. The rating system is, you can learn more about how they calculate the rating system here. But the rating system is a compilation of weighted scores based on health inspections or annual surveys, their staffing levels that are self-reported by the facility, or the quality measures, which are the clinical outcomes that patients experience in that facility. So if we go to the view inspection results, okay, that will give us the history over the last 3 years of the surveys that have been completed. You can view the entire report by clicking the link there, and it'll take you to the actual survey report. So this is a typical survey report that identifies here the name of the facility, their address, the regulation as it's stated, and then this includes what's called a statement of deficient practice, what they did wrong, and the evidence. So you can read that and certainly have enough information to ask questions of the facility about this. These survey reports are also posted in the facility. In every facility, they're required to post them. Now, if I wanted to compare different facilities against one another, what I would do is go back to that initial page, okay? And instead of clicking on the name of the facility, I can say, okay, I want to compare this facility. So it allows me to choose up to 3 facilities to compare side by side. So I'm just going to take the first, I'll take Lynbrook, and I'm also going to take the Grand Pavilion. Okay, so I identified those 3. And then I'm going to go to the top right, and I'm going to hit compare. And you'll see it'll format those 3 facilities in a side-by-side comparison so that I can look at the overall rating, I can look at the health inspection reports, the staffing reports, and the quality measures. I think it's important to look at the detail of the reports rather than to just rely solely on the 5-star system. There are many good facilities that are currently at 2 stars, and there are some not so great facilities that are 4 and 5 stars. So it really depends on what you're looking for. You really just use it as one of a number of issues that you look at or consider. So when families are confronted with making choices about which hospital or which nursing home or home health agency to use, it's really important that they exercise their due diligence, go on the Medicare Care Compare website, and look through the information that's available so that you can arm yourself with information and ask questions of your doctor or ask questions of the hospital staff so that you can make the best decision and be proactive in selecting the facility that's right for you or for your relative.